recognize Representative Barraga from California for her 5 minutes of questions.
Thank you, Madam Chair. This is a great conversation to be having, although to do it in a context of what's going on in this country is to turn a blind eye. You know, the Trump administration has caused chaos at the Centers for Disease Control. Under Secretary Kennedy's leadership, thousands of dedicated public health workers have been fired. Scientific experts like a former CDC director have been forced out, and hundreds of millions of dollars in critical research funds have been canceled. This week, 8 former CDC directors who served under presidents from Jimmy Carter to Donald Trump took the extraordinary step of sounding the alarm in an op-ed. Now, this is it. The title says it all. It says, "We ran the CDC. Kennedy is endangering every American's health." Think about that for a moment, that the Secretary of HHS is endangering the health of every American. They write that the administration has done is, quote, "unlike anything we've ever seen at the agency and unlike anything our country had ever experienced," end quote. They warn that Americans are now less protected from cancer, heart disease, and infectious disease. They note the CDC is being directed to downplay vaccines and pursue unproven treatments. I want to ask for unanimous consent to enter the former CDC's director's op-ed into the record.
Without objection, so ordered.
I think we should be taking up legislation to protect workers at the CDC. My colleague, Representative McClellan, has a bill to prevent mass firings at HHS. And I recently introduced a bill that would protect our Public Health Workforce Act to bring back the CDC staff that Trump has fired. Instead of oversight hearings or legislative action to hold this administration accountable, Republicans continue to pretend that nothing has happened. And so you can't go on without saying something at this hearing. Dr. Ibrahim, I want to turn your attention to AI and the topic at hand today. AI has shown real promise in healthcare, such as helping doctors catch devastating diseases like cancer earlier. But as of last year, over 600 AI applications approved by the FDA, out of over 600 applications approved by the FDA, less than 10 were eligible for reimbursement from the Centers for Medicare and Medicaid Services. That's less than 2%. Does that number concern you, or is that a good thing?
Thank you so much for raising that point, and it has some historical context that the role of the FDA and the way it's been statutorily designed has disproportionately focused on safety and effectiveness and deferred the decision of reimbursement to CMS, which unfortunately creates almost reinventing the wheel because a lot of the material they have to review and evaluate ends up being redundant. There have been some efforts to address that in parallel path reviews. Ultimately, I think what would be more efficient is if we focused the rigorous evaluation up front by the FDA, and if it got FDA approval, that it would then be reimbursed by CMS.
Well, thank you. You know, first when you look at the number, you think like, oh geez, people are not getting access to these AI tools that could be, you know, life-saving. But of course, we've heard today about other concerns about trust and regulation and whether it's helpful or whether you need to have a plan in place. Dr. Mello, what can Congress do to make sure AI healthcare tools are accessible to more people?
Yeah, so both of the things that you just said are true at once, right? That we are concerned that there's not enough access and that there are real, policy barriers to getting there. Again, where I land is, if I am a hospital, I'm doing radiological scans, what's going to move me to spend more on AI if there's no reimbursement? Maybe it's a substantial improvement in quality of care, but that sometimes is not documented. Maybe my radiologists are clamoring for it, but they know they're on the hook if anything goes wrong. So this trust deficit really matters, and the steps that I've outlined, including both modifications of FDA review, modifications to reimbursement, but also institutional governance, that's the pathway forward.
Thank you. Dr. Mello, the use of AI can reduce workloads and improve efficiency in our healthcare system, but it can also make mistakes. Earlier this year, HH Secretary Kennedy released a report that was based on incorrect information and made up sources because of AI. How can we ensure that AI is used responsibly and with full accountability in the healthcare system, especially when it affects people's trust in science and their health?
I think it only begins by saying there's a human in the loop that's supposed to be reading that stuff. You have to create the conditions to make it possible for him or her to do that job in the setting where they're working. And right now, hospitals are not doing that.
Great. Thank you all. With that, I yield back.